India has reported a daily rise in new coronavirus infections of 100,636. And now these cases have come in the past 24 hours. The death toll rose by 2,427, and the infection tally now stands at 28.9 million, while the death toll has reached 349,186. The government eased coronavirus restrictions today.
The rugged and unforgiving landscapes of Jammu and Kashmir, now vaccination hubs. Wearing protective suits, health workers and administrative officials climbed the steep hills to reach nomads in remote areas on Sunday, as India continues to ramp up its inoculation campaign. But it's a mammoth task. Less than 5% of 950 million adult Indians have received the mandatory 2 vaccine doses. This village is not accessible by any kind of vehicle.
For the first time, a team of doctors has come to us nomads. We're very thankful to them for vaccinating us all.
The landscape is a world away from the megacities which reopened for business on Monday, with long queues for buses in the financial hub of Mumbai, while traffic returned to the roads of New Delhi after the devastating second wave. Infections have now hit a 2-month low, allowing authorities to reopen parts of the economy. Prime Minister Narendra Modi said on Monday that the Indian federal government would provide vaccines free of charge to all adults from later this month.
For more on this, we're now joined by Dr. Rajib Dasgupta, who's the chairperson of the Centre of Social Medicine and Community Health at the Jawaharlal Nehru University in New Delhi in India. Dr. Dasgupta, thank you so much indeed for joining us. Always good to talk to you. Thanks for your time.
Hello, good evening.
So we're seeing restrictions on transport, markets and other economic activities, particularly in Delhi, being lifted and eased from today. In the context of where you are in the disease cycle, is this a good thing to do?
Well, as your report indicated, after several savage weeks of the very ferocious form of the epidemic, with 4,000 plus deaths daily, the new cases now has certainly come down a lot. Yet it's to remember that it's still above the peak of the first wave. So there's still a substantial number of cases, 1.5 million active cases in the country. However, on the positive side, the test positivity rate has fallen below 5% in many states, in nearly a dozen states, of course, including about half a dozen of the larger states. It remains above the 10% mark. So it is a mixed picture across the country, and all state governments and administrations certainly have to make a choice between lives and livelihoods, and hence a very careful stage-by-stage reopening of the economic activities.
How ramped up is the vaccination program now? Because that'll be one of the key levers in managing this disease.
Quite so. Vaccination is going to be certainly one of the key pillars. And in terms of the daily vaccination coverage figure, we have had ups and downs, and the month of May particularly had been relatively a crunch month, as vaccine supplies had been a limiting factor. Now with supplies gradually improving, it's beginning to climb up, and currently about 30,000 vaccination centers are in operation, nearly 2,000 of them in the private sector. But it's certainly fallen from a high of about 65,000 vaccination centers in the country. But as in the coming weeks vaccine supply improves, we expect this certainly to go up, and it does need to go up a lot.
We've seen the numbers come down in the last week or so, and I just wonder, do you believe that the worst is over now?
The question is in terms of the number of cases, the number of
yes,
vaccinations.
in terms of cases of COVID-19.
Oh yes, as far as the second wave goes, the peak is certainly past us, yet it continues to be quite a significant force in several key states, particularly some of the southern states, but those are also beginning to slow down. And the second wave is certainly going to be over in the next 2, 3, or 4 weeks, perhaps. But it's certainly taken a very big toll.
And the variant that was first discovered in India, I suppose, largely is what's contributed to this current surge that is being managed. Is there any idea that other variants may still come that might prove a problem for the vaccination program?
The variant, the Delta variant, or the B.1.617.2, certainly has even higher transmissibility than the earlier highly transmissible UK virus or the alpha strain, which is also been responsible for the surge in some parts of the country. But the Delta variant certainly has played havoc in several states. So each time the virus multiplies, a virus like this, it is a roll of dice, and new mutant forms can emerge. And therefore, the possibility certainly remains, both in terms of surge in new areas of populations, as well as the protection of vaccines against currently circulating mutants. And therefore, the genomic surveillance program, which in India is a national consortium of 10 laboratories, the surveillance that these laboratories, along with the epidemiological services across the states, are going to play, is going to be an important factor in being able to keep a tab on this.
The opposition parties certainly have had their say on the issue, but how would you assess Narendra Modi's government's handling of the COVID-19 pandemic, and in particular this second wave?
The second wave certainly caught everyone by surprise, the magnitude of it. Some of the early signals were perhaps not given the importance that it deserved. This has been stated by the modeling group, which makes the modeling forecasts. This has also been stated by the genomic surveillance group, and therefore there is a possibility that some of the early warning signals could have been interpreted differently. Having said that, both the federal government as well as the state governments certainly put out their best, given the enormity of the challenge. And this has to be understood in conjunction with the support that India received from a number of countries from across the world in terms of essential supplies, drugs, and vaccines as well now.
I'm reading a report that's come through here that says that the National Institute of Virology has detected a new COVID-19 variant, B.1.1.2.8.2. What do we know about this new variant?
Well, it's still early days. New variants will continue to be detected. What's important is to be able to triangulate this with epidemiological findings coming from the field, what we call the molecular epidemiology. Molecular epidemiology, for example, has played a very key role in understanding the spread of the poliovirus in the closing days of the polio campaign. And it's really the molecular epidemiologic understanding of what the virus is doing in certain parts of the country from where these are detected are actually the key to some very nimble-footed control in the surge areas in case these variants are contributing to unexpected surges.
One of the challenges that we're facing here in South Africa is partly because of the length of this pandemic. There's been a fatigue in terms of behavior complying with protocols, the non-therapeutic protocols. Is this something that you're seeing in India as well?
Yes, this is something which worries large populations all across the world, including India. This actually means investing a lot more than we are into behavioral studies, into understanding practices, into understanding how individuals or communities understand risk and risk from this disease, and therefore practice or not practice certain behaviors, including, and this includes understanding of vaccine hesitancy or vaccine acceptance, and therefore investing into these studies, into these surveys, and using that learning to frame community engagement strategies, communication messages. Those are going to be key tasks as we come out of this second wave.
All right, and I suppose one has to just keep on sending out this message. One of the issues before were these super spreader events, and these were religious festivals and people getting into the Ganges and things like that. Are there many more of these on the calendar still to come, or have we passed that hurdle at least?
Well, there are major festivals almost each month, though not necessarily at the national level or at a very large scale, but certainly in different parts of the country. The lesson that we have learned from all kinds of congregations, earlier religious congregations, political congregations, is certainly that it can't be festivals as usual. And therefore, this is something on which governments and administrations certainly need to do a lot of rethink. But having said that, there have been other festivals, other major festivals last year, for example, in October, November, absolutely national festivals, which were celebrated with a lot of restraint. What's been different in some of these congregations, particularly in March, April, is the fact that these new variants were actually spreading fast, and the fact that these new variants have a very high transmissibility, and in that particular context, these congregations actually amplified the infections a whole lot. But this is not to say that it can be congregations as usual, but the second wave did come in a very special context.
I may have asked you this question before, but when I consider just how big India is in terms of population, 1.1, 1.2 billion people, you've done incredibly well, actually, in terms of infection rates and fatalities, because it could have been far worse, especially when one considers some of the more densely populated cities in your country.
Yes, sure enough, and that's been a worry from day one, from a situation like COVID, and this owes to the sacrifice and endless hard work, not just from the health workers, doctors, nurses, paramedics, but a whole lot of supporting cadres of workers, of volunteers, and it's a tribute to their hard work and sacrifice that we have actually managed, as you very rightly say, reasonably well, given the enormity of the challenges.
Dr. Dasgupta, thank you so much indeed for joining us. Your insights, greatly appreciated. Thank you for your time, sir.
Thank you and good night.
Good night. All right, so that's the situation in India. Cities like Delhi are seeing an easing of restrictions in marketing activity and movement as the new infection rates have started to come down, and it looks like they've gone over the worst in terms of the second wave, but certainly still a way to go before vaccinations start to kick in terms of becoming a key pillar in dealing with the virus.